try to to have dinner with them.
It was great, thanks.
Lord, have accepted.
How are you?
My hand, I need to cure my hand. Oh,
I
need to start to bed.
Thank you. Thank you.
I'd like to try to move this
That must be interesting. Thank
Sorry.
you.
Could you help us move the mic right in front of you? Here you are.
I was wondering, like I said, during that particular, I find it like so incredibly interesting by it. People who are more kind of scientifically.
All right.
I mean,
Sanukta, would you mind passing that turtle in my direction?
Thank you.
Thank you.
sorry.
And should we head it on all the way? Should we continue down that?
Yes, we would like to.
So we're just moving down the turtle to the speaker, I think.
Right.
Yeah.
That's right. That's right.
No, we will have one. Okay, I think one of them should. Just a short logistical note. Please make sure we're back to the mic so that she can knowledge that we have given for equally.
Okay, that's important.
I should have come with my computer. I like taking.
I don't know.
Keep losing notes.
It doesn't matter. I can sit wherever as long as I can.
Thank you. Yeah, no. Because I have one. I went to come back. It's trying to find. There we it here now. My notes are.
Thank you. I know you have to go at 11, so I guess we'll start now that you're here.
It's internal.
Yeah, I remember. Yeah. Okay, wonderful. Did I say it?
Okay.
Absolutely.
Because for now, 7. It's 5.
Lola, we can start.
Yes. Hi, good morning, everyone. Welcome. Thank you. We are going to start shortly. Please kindly mute your microphone and please also turn your phone to silent mode so that there will not be any echo. Thank you very much, and we will start now.
Well, thank you, and I hope that all the people that are online are able to hear me. Please write something if you're not able to hear, and we'll see whether we can help you remotely. But just to say, first of all, thank you to Population Council for being here to present this work on dreams that's being implemented by PEPFAR across 15 countries, and there are additional countries that are implementing dreams-like initiatives. From UNICEF, I just want to say that going back to the Durban conference, when UNAIDS actually put out the GAP report, which raised concern about the fact that the world is not doing enough about prevention, but also raised concern about the disproportionate affection of girls, especially as Carisha and husband in Durban were releasing the results of the impact of HIV on adolescents, and the fact that there is a life cycle to it. So girls are being infected very early, and the reason for that is multiple, including the fact that they're engaged in transactional sex very early in life for all kinds of reasons. But then what happens later on is that when they decide to get married, they're getting married to their peers and not to older men, and then the cycle continues. And so this raised a big concern at the conference, and we are happy that the US government has actually responded in putting together this comprehensive approach that touches on multiple vulnerabilities of girls and implementing this program in a number of countries. And just to say that within the program, there's the implementation and the partners that are implementing within countries. The focus is very much where most of the infections are happening, and also targeting the most vulnerable girls with multiple interventions that we'll hear about. But also it is important to acknowledge that we shouldn't pretend that we know how to do this effectively. And so within the PEP of Dreams program, there's a huge component for capacity development of the implementers. But the second part of this is the implementation science, which again, POP Council will talk to us about in terms of their engagement in the program, learning as we are doing and documenting the lessons learned so that we can sharpen the program. So without much ado, I'll hand over to Roberto, who is actually charged here at UNICEF to support the work that we are doing as part of ED4's young people agenda. Roberto is actually involved in the actual conceptualization of that, and it's important for us to actually make sure that what we are discussing today is within the framework of what UNICEF is trying to do around young people. So I'll pass on to Roberto to just say a few words, and then I'll pass it on to Population Council to get on with the presentation on dreams.
So thank you, Chairwood. Thank you, HIV Agenda section, for the kind invitation, and all of you. And it's actually very interesting and timely that I have this opportunity on behalf of the Secretariat of the Young People Agenda to present briefly some of the parameters of this new global partnership, because it has natural points of contact with the agenda that you are discussing today, and most importantly, the mission and the commitment that every day you put in place for young people and girls in particular. A new partnership on young people is timely. And I'm going to refer to two things that the chair just said minutes ago. No, the world is not doing enough, and the impact on girls is disproportionately high when it comes to a number of unaddressed development challenges. And this new partnership is focusing in particular on some of the key challenges that are affecting today, presently, young people, but that if not addressed will have an enormous cost in the generations to come. So the sense of urgency, this call for an immediate focus on young people, is something that on the development table is very much put as a priority. And the Young People Agenda is a global partnership to mobilize efforts from a variety of partners, not only the traditional multilaterals, but also private sector, to a form that perhaps, at least from UNICEF, that is one of the actors that is designing this agenda. We hadn't seen before this willingness to get private sector also around the table as a technical contributor, not only in terms of resources, civil society, think tanks and academia, governments, but most importantly, young people organizations themselves. So in the design, the idea behind this global partnership is to leverage resources from a variety of partners, not only to lift the profile of the challenge and the urgency of addressing these challenges, but most concretely to channel resources to replicate at scale good practices, solutions that work at country level, but have potential for larger scale. So what we think it's important behind the Young People Agenda, it has a very concrete operational arm. It's not only a global partnership to create political will, to create noise around unaddressed challenges for young people and adolescents, but also has a very direct track to pool and channel resources to those programs, projects, initiatives, new ideas, more on the innovations side of the spectrum, that provide evidence of result. We know it works, but with additional resources could reach maximum scale. This is why in the architecture of the Young People Agenda, there are rounds, circular rounds of identification of these solutions through a call and co-creation with partners, curation of these solutions through a process of quality assurance to see what are the bottlenecks, how can we unlock those bottlenecks, what can be improved and co-created, matching resources and replication at scale. This is at the core of the mechanics of the Young People Agenda. But of course, it's not only channeling resources. As a matter of fact, it is not a fund we are talking about, although there is a component of channeling financial resources. But most importantly, the idea is to pool together all those that are associated to this nascent agenda, pool together resources and match them with solutions that have potential at scale. In addition, create a political space at the highest possible level to try to give all light and visibility possible to key challenges. And I'm coming now to the thematic core of the Young People Agenda. At this stage especially, the focus is strongly on skills. And there are three thematic buckets behind the Young People's Agenda. One is secondary age education, and it's important to stress the age part, because it's not narrowly around the secondary education, but secondary age education, because we know the majority of adolescents and people not in school are in age where they should be at school. So this is why this equity approach is so important. Skills for learning, employability, and decent work. So there is an explicit identity in strengthening the school-to-work transition for a productive entry into labor market. But importantly, the third theme, and this is where a lot of synergies are possible with your work, is empowerment with the focus on girls. And this is also what we like as a human rights organization, as an organization with a normative role. Our concern is not only to help young people transition in a productive adult life, but is to transition into safe and active citizenship. This is why it's so important also the third bucket on empowerment with the focus of girls. And this, of course, includes civical engagement, digital participation, all the boundaries that the modern technology is pushing in participation in its different forms. And of course, this also has a lot to see with building those core life skills, and this comes very close to the work that you are doing. The core skills to ensure that especially girls can transition into adult life safe, aware, protected, empowered. So saying this, the Young People Agenda is a new initiative. It started literally a few months ago, probably 4 months ago. This is why a team is pulled together to work with a number of divisions in UNICEF, most importantly with other partners, to design and start implementing this agenda. It is a very much an open and inclusive process. There are already in the membership that we are creating not only other UN agencies, but we have private sector, we have important NGOs, we have young people organizations that are part, and young people themselves as one of the young faces of this agenda. So the ambition is to create a space that go way beyond UNICEF. And as a matter of fact, UNICEF will not change anything on what is currently doing programmatically. Our key reference is the strategic plan, and our strategic plan as core business document will remain our reference, so programming for adolescents, to speak in very correct programmatic terms. But there will be more active effort to connect, to liaise, to pull partners together to ensure that the transition works well, and that young people defined in this stage of the agenda from 10 to 24 goes beyond the agency's mandate, where everyone will contribute according to its mandate, its nature, and its institutional contribution, but the dialogue is much more fluid to ensure that we can accompany safely adolescents into young age and adulthood. Just a concluding comment on how the agenda will continue. So a first round of solutions started. We have identified through an initial process of co-creation with partners 109 solutions that an external partner, Cambridge Education, has quality assured to a final stage of around 20. And these 20 solutions these days are being shared with the partners that expressed an interest in being associated with the young people agenda for further discussion and validation. That first pool, most likely, if validated, will be the first set of solutions that will receive a support package. And support in a very broad way. Again, it's not only the funding needed to reach higher scale, but technical expertise, access to knowledge and information, access to learning opportunity, access to opportunity of horizontal dialogue and cooperation. And then, hopefully by the end of the year, implementation will start in the countries where those same solutions have been identified. Okay? And this will be a cyclical approach with other iteration of solutions, unification, etc. So I just stop here because I know that you have an important agenda, but I just wanted to give you a first overview of the process of designing the young people's agenda with, and probably the most important message is that it is an open and inclusive process that has a thematic focus, because we believe that there are already a lot of work out there, and we need to be humble and focused in ensuring that we target a specific area of need out there. This is why the 3 buckets are defined fairly well. But at the same time, it's a global partnership that embraces everybody that is willing to pool resources and benefit from this positive dynamic. So happy to provide you with any other information. I'm actually here, I'm transitioning now on a permanent basis to New York, and actually the reason why I'm so close to Chewa's team is because they've been so good to host me physically in their space. This is why I share a bond of gratitude. But please feel free to email me through the team, and I'll be happy to share any other information and continue this dialogue. Yeah?
Excellent, Roberto. We will not have a question and answer. We have planned for a question and answer session at the end. So if that's okay with you, I'll move on to Pop Council, and I'll hand over to Julie to take on from now. So if you can push this.
I will excuse myself.
And we'll dive into the presentation, but Julie, please, if you have any remarks and comments.
Good to meet you.
Yeah.
Thank you, Cherry. Good morning, everyone. My name is Julie Pullerwitz, and I'm the director of the HIV and AIDS program at the Population Council. And I'm joined by a couple of my colleagues here, who I'll introduce in just a moment, but just wanted to say how pleased we were to be able to come over and share with you Really an overview of some of our work related to addressing adolescent girl and young women's HIV risk and empowerment, and particularly highlighting some of the lessons that we're learning from our DREAMS-related portfolios. Now, how do I change slides? Thank you.
Okay.
So I'll just say slide change, please. Wonderful. So the three of us are here. We're going to tag team just a bit. And I'm here both in my role as the director of the HIV and AIDS program, and really pleased to see some long-standing colleagues as well as new ones around the room. And also as the role of one of the PIs of the portfolio of work looking at male partners of adolescent girls and young women underneath the DREAMS portfolio. And I'm joined by Sangyukta Mathur, to my left, who is the overall director of the implementation science around DREAMS, and Miriam Temin, who is the overall director of the capacity strengthening work for DREAMS that's taking place at the council. Next slide. So the Population Council is a mainly research organization that focuses on generating evidence that can be applied to improve programs and policies related to health and development for vulnerable populations across the world. And the Population Council just celebrated its 65th anniversary last year. We have work in about 50 countries at this point, and over 60% of our staff are actually based in the global south. Our headquarters in New York are actually just a few blocks away from here, so you know where to find us in the future if we were to get back together and talk more about these issues. And we do a range of work from biomedical technology type of work, whereby, just one statistic, 20% of women who currently contracept use technologies that were developed by the Population Council globally. To our social science research, which is represented by our DREAMS portfolio that we're going to be talking about today. Next slide. I thought I'd touch on three streams of work that the Council has been working on for the last decades that all tie nicely together to lead to our work around the DREAMS initiative. The first is decades worth of work with a focus on adolescent girls' empowerment. And so we conduct research to try to test out different strategies to improve health and development outcomes, whether they relate to HIV, gender-based violence, education and literacy outcomes, income outcomes, all of those multi-sectoral perspective for vulnerable girls and young women. And I would highlight come from the perspective of intentional design, where we engage our beneficiaries and our partners on the ground and start particularly with the perspective of the girls themselves, and then try to build work that is relevant for the multifaceted needs of girls and young women, whether that be related to their health or accessing education, income, etc. Here are just two photos or figures of some of the tools and resources that we have around girl-centered programming on the right, so the manuals, tools, as well as some of our systematic analyses and reviews around what are the gaps regarding girl-centered programming at this point. Next slide, please. A second stream of work relates to our HIV research and programs. And here we're focused on identifying effective solutions to improve the HIV response. We do a lot of practical how-to types of implementation science where we're testing out different strategies in different cultural contexts to see what works to improve programs, to engage people to access services, etc. And in particular, we think about the socio-structural context when we're trying to do this. So it's not just about getting the pill in the mouth, it's all about what is the context that all of our vulnerable populations live within that lead to risk or lead to not being able to access services, for example. So there are three areas we work on quite a bit is how to best reach hard-to-reach populations, such as stigmatized and marginalized populations like sex workers. We think explicitly about gender inequities, and so I was so pleased to see the link between the HIV team and the gender teams here today, and relationship power dynamics and how that affects people's ability to engage in HIV risk reduction or access services. And we think a lot about stigma, whether it be HIV stigma or the stigmas that are interrelated around, for example, taboo or norm-breaking behaviors. Next slide, please. And then the third piece of work that we do is a real focus on how do you translate all this information and get it used so we can see the impact in programs and policy. And we do this through a really systematic process of engaging various stakeholders from the very beginning to, for example, ensure the relevance of our study objectives and results. We help design questions together with communities, with stakeholders. We then promote the use of these results to help guide program planning, program implementation, and we do a lot of building bridges between researchers and program managers or policymakers because the language often doesn't translate directly. How do you do translational science? What we're focusing on. And then lastly, we do a fair amount of capacity strengthening, whether it be capacity strengthening of researchers so that they can produce findings that are usable for programmers on the ground, or whether it's with programmers and policymakers so that they can take in and use the evidence and apply it to their programs. Next slide, please. So now I just wanted to put up one slide, harkening back to what Chewe was saying earlier around girls' risk of HIV, to remind us kind of why we are here talking about dreams. And this is actually a slide that we took from a UNICEF analysis on the bottom left of UNAIDS 2017 work. And so you can see by the lines on this graph, young girls, or in this case it's adolescents 15 to 19, are both at high risk of HIV and disproportionately affected in many areas in Eastern and Southern Africa. And this leads to, I think, around 7,000 girls acquiring HIV a week. I mean, these are huge numbers. And as Roberto said, even though we've invested so much money through PEPFAR, through other funders over time, it's clear that it has not been successful for girls and young women. And there was a real need to focus on this particularly vulnerable group. And that led to this DREAMS initiative and partnership. Next slide. So I have just a couple more slides to give a quick overview of DREAMS. Many of you may be familiar with DREAMS, may not know that it stands for Determined, Resilient, Empowered, AIDS-Free, Mentored, and Safe Women. And so that is the acronym, and the intention is to reduce HIV infection rates amongst adolescent girls and young women in these countries we're talking about. It initially started in 10 countries, and it has expanded to another 5. And it is a public-private partnership, as I think Roberto referred to as well. So it's spearheaded by PEPFAR and the U.S. government with the programming, but the Bill and Melinda Gates Foundation engaged very early on to fund the evidence generation portfolio. Girl Effect engaged early on to fund the capacity strengthening work for implementing partners who in many cases are implementing for the first time really girl-focused programming. And then we have a number of pharma groups who are involved in the biomedical side of the intervention. So it's been quite a large group with a very active partnership with a lot of investment at this point. Next slide. From our perspective, what's different about DREAMS is this focus on most vulnerable girls and young women. So in the past, there had been a lot of community-based work, but here we really have that focus on girls and young women. Also that it's addressing the multi-sectoral topics that we were talking about to address the structural determinants of risk. And they're very explicit about gender, addressing gender norms, thinking about that in society and in interpersonal relationships. It's a package that also includes several new interventions, such as PrEP, so pre-exposure prophylaxis, which is being implemented in some of the DREAMS countries, where it's a pill, many of you know, a pill that can prevent transmission of HIV from one person to another. It includes cash transfers in some of the countries, so it has an economic component. And in, I think, all of the countries, it includes a component of what's called social asset building, which is an area that the Population Council has been working in for the last decades, around how to promote different assets that these girls would have, whether they be social, mentors, other peers that they could talk about these issues, being able to be connected through these networks to health systems, how do you access the cash transfers, et cetera, et cetera. So it's this platform of social assets and group support. And also there's includes very young adolescent girls, so age 10 to 14. It addresses the range of adolescent girls and young women to set them up for kind of success, a trajectory along the way. Next slide. So here's one slide, just a quick snapshot of the different components of the interventions. So the girl is in the center, and the empowerment of the girl and reducing risk is the goal. But also there's the engagement of communities, strengthening families, characterizing and reaching male sexual partners. And what's particularly notable, I think, is that in this case, the goal is to provide all the different components of the intervention in one place. So they're calling it, the way they describe it is it's being layered in one location. And these locations are the places where girls are most at risk, so have the highest HIV incidence. So this layering is also new in that many of the components existed before, but often not all in one place at one time. Next slide, please. So the Population Council's role on DREAMS is multiple, but twofold that we're going to highlight today. The first is to generate evidence so that we know what's working well, what's not working well, how are you best reaching the male partners, what are the effects of this different package in different contexts. And then secondly, to build capacity amongst the implementing partners who are working in these girl-focused platforms to bring our kind of lessons over time so that they can do that most effectively. And I mentioned the different partners, so much of the funding for the Population Council comes for Bill and Melinda Gates Foundation for the research side, and some from PEPFAR, as well as Girl Effect for the capacity strengthening, and again, some from PEPFAR through a project called Project SOAR, which is a large implementation science program around all things HIV. So happy to talk about that project at another time. There are 60 studies that are underway, and we're learning lots of wonderful information about how best to do community-based programming, for example. So I think that's my final slide. Let's see, next slide, please. And now I'll turn it over to Sanyukta Mathur to talk in more detail about our implementation science portfolio. Thank you.
Great. Good morning. I'm Sanyukta Mathur. I'm with the Population Council, and I'm based in our Washington, D.C. office. As Julie said, very pleased to be here and to be able to share some of our emerging findings with you. I'm presenting a large portfolio, and I'm joined in the room by several of our colleagues who are PIs on the studies. Julie mentioned she's a PI on the study, but I'm also joined by Drs. Ann Goddard, Lesta Pilgrim, Jerry Okala, and Maurice Musheke, who are working very closely on this portfolio and can be available for questions. I don't think I'm providing them to be available for questions. Next slide, please. Let me talk a little bit about our portfolio and what we're doing. Great. So as Julie said, that we are generating evidence around DREAMS, and we're really focusing on 3 cross-cutting themes that are looking at some of the unique features of DREAMS. We landed on these themes through a very extensive process of looking at what each of the DREAMS country teams was interested in examining, what were the key implementation science questions that they were asking, what were the donors asking, what were other development partners asking, and what was the need in the field. And we coalesced around 3 main questions. The first one is around the core of DREAMS, which is the community-based girl-centered programming, which is a unique element. So HIV programs have been done with adolescents and with key populations, but usually at the individual level. Here, the programming is going to the community with that comprehensive package that Julie mentioned. So in those sets of questions, we're trying to examine how does one find the right girl, how are they engaging them in programs, what is the impact of these programs, what is the cost of some of these programs. We have a second set of questions around male partners of adolescent girls. We know that there are a lot of age-disparate partnerships that are fueling some of the heterosexual transmission. We also know at the same time that men are delayed in terms of accessing HIV services. So this set of research is really trying to understand men's own risk factors, their relationship dynamics with their partners, and how can we best engage men to connect with HIV services. And the third set of our portfolio is really looking at this new biomedical intervention, oral pre-exposure prophylaxis, and how do we introduce this new biomedical technology such that adolescent girls and young women who are often the least empowered, most disconnected from HIV services, are able to access this in a safe and stigmatized way. Next slide, please. We have 10 research activities currently underway in this portfolio across 7 of the DREAMS countries. How we landed on which study we're doing in each country was also a process of discussion and negotiation with each of the country teams. So once we decided on the questions, each of the country teams basically selected which questions they wanted to answer, which ones they felt were most relevant in country. And so you'll see in some countries we're looking at multiple issues, for instance in Malawi and South Africa, and in Swaziland we're looking particularly at the male partner. So we've tried to pick, assign, or look at topics in countries where the questions were most salient. Next slide, please. We've used I want to just talk briefly about our research approach. We're here if you'd like to talk more about methods. We can go into more detail, but very briefly, we used a 2-phase study design. One of the things that was very important to us, because DREAMS is basically being implemented at scale, and there's a lot of questions, as Chewe mentioned, about how is this all working. So we have the studies that collected data early about looking at characterizing adolescent girls, their male partners, looking at feasibility, acceptability of PrEP, and those results we rapidly fed back into program implementers as well as PEPFAR and other development partners. And the second phase of our studies that's really looking at effectiveness of some of these approaches. What we are going to be sharing with you today are emerging results from phase 1. And actually, we will have results from phase 2 later this year, so stay tuned for that. All of the studies are mixed methods. We include multiple perspectives, so not just adolescent girls and young women, but men, implementers, policymakers, healthcare providers. And one of the key pieces that Julie already mentioned, we've had a very explicit focus of engaging in-country stakeholders early and often throughout the research processes, including representatives from the National AIDS Control Organizations as co-PIs or co-investigators on our studies, so they are aware of the work that we are doing and to ensure that the questions we are asking are relevant for their country context. Next slide, please. So with that overview, I'm going to launch into sharing some of the results. One of the things that our studies confirm is the very high concentrations of HIV risk among adolescent girls and young women in the DREAMS sites. So as Julie mentioned, these sites have been particularly selected because they have the highest HIV prevalence, highest proportion of adolescent girls and young women, the least connectivity to services, and girls' risk is multifaceted. This is just one data slide, and we asked over almost 2,000 girls in Kenya and Zambia about their violence experience in the last year, and about 1/5 of them had experienced some type of either physical or sexual violence from either a partner or a non-intimate partner in the last year. This is just the proportion of girls who are reporting sexual violence. So if you're familiar with sexual violence literature, this is likely the tip of the iceberg. Very few of these girls are accessing services. And we also see in our data that girls who've experienced sexual violence are twice as likely to report STI symptoms, as well as poor mental health outcomes. So there are very high concentrations of risk in these communities. Next slide, please. We also find that this is based on data collected early in the DREAMS programming, that DREAMS is reaching many at-risk adolescent girls and young women. DREAMS partners are employing a variety of methods to identify which girls are most at risk in their communities. So by and large, partners are reaching girls that have experienced parental loss, STI experiences, who are engaged in high-risk sexual behaviors like having multiple partnerships, and as I mentioned, they're in high-risk sexual relationships where they experience a lot of violence. Next slide, please. There are still some subpopulations of adolescent girls and young women that were not as well represented early in the DREAMS programming, particularly those that were out of school and those that are sexually active. So this information we fed back in very rapidly to the DREAMS program implementing partners to think about what are the strategies to try and look at this gap. How do we really get to the out-of-school sexually active girls that are not being reached through the multi-layered sort of screening tools and access points that the partners are trying? Next slide, please. And more recently, we have been thinking about how can we better identify whom to reach. So if we're not reaching out-of-school girls, and we know from the HIV literature that they're at higher risk of HIV, and you have limited resource, how can you identify who really is who are the right girls to reach within a community-based setting? we've been doing some innovative segmentation analysis where we're looking not just at knowledge and attitudes and sociodemographic characteristics, but combining sociodemographic attitudes and behavioral factors using latent class analysis to identify the profiles of girls that really need to be reached. So let me share with you one example of that. Next slide, please. So this is vulnerability profiles of adolescent girls and young women in Kisumu County, Kenya. This is urban and peri-urban sites. And what we find is that among the girls that are out of school, there is a third of the girls that are particularly vulnerable. They are the ones who are double orphaned. They are the ones who are hungry. They're the ones who are not connected to any adult in the household. They have very early sexual debut. They have some moderate HIV risk perception. They have very high gender inequity. And they don't have any comprehensive knowledge of HIV or condoms. So in terms of thinking about how when we do community-based programming, whom we really need to reach, we think this type of profiling, this type of analysis, secondary analysis of data, can help fine-tune and identify whom we really need to reach. If you could click, yeah. And what we find is that the girls who are in this higher vulnerability profile, again, in a very high vulnerability context, but the third of the girls who are in the out-of-school high vulnerability profile are more likely to report current sexual risk behaviors. Next slide. I also wanted to talk a little bit about some of the work that we've been doing looking at relationship power. As Julie mentioned, we're excited that the gender and HIV teams have come together because this is a key aspect of what is increasing adolescent girls' risk. And not surprisingly, we find that adolescent girls remote limited power in their sexual relationships. What is interesting, however, is that older respondents consistently reported lower levels of power compared to younger respondents. And that relationship power is strongly associated with being less likely to experience sexual violence, less likely to experience physical partner violence, and more likely to report condom use and have increased knowledge about partners' HIV status. So the fact that DREAMS is looking at partners and we want to think about gender transformative programming, I think is an important point to be made here. And indeed, male partners of adolescent girls are engaged in a lot of risk behavior. So this is data from about 1,000 men in Durban, South Africa. Of the men that we surveyed, both at community hotspots as well as at health facilities, 74% of them had an adolescent girl partner in the last year. 55% had 2 or more adolescent girl partners, and 18% had 3 or more. And there's a portion, 13% of the men had multiple partners who were 10 plus years younger. What is interesting is that we can also see the cycle of transmission in the data. Over half of the men had both adolescent girl partners as well as partners who were over 25. So the CAPRISA sort of cycle of transmission is visible even within this data set. Next slide. We also find that some of the gender dynamics play out in the types of relationships that men are engaged with adolescent girls, which are characterized often by conflict and miscommunication, and in fact fueling multiple partnerships. This is a graphic based on qualitative data with 94 male partners of adolescent girls from 3 districts in Uganda, where marriage is fairly common. So men talked about getting married early, usually to an adolescent partner, but talked extensively about frequent separation, miscommunication, conflict that they said perpetuated them to seek out additional partners, often adolescent girl partners. So this was a pattern and a cycle that was repeated often within this data set. Next slide, please. We also find very extensive men's history of trauma. Again, we're looking at men's vulnerability and how it's affecting adolescent girl risk, but also how it's affecting their risk. And we find that 59% of men, again, this is South Africa again, had experienced an armed attack. A very large proportion had been exposed to violence in the home or had seen their mother being abused. And these adult as well as childhood experiences of violence are associated with their current risk behaviors, so having multiple sexual partners and inconsistent condom use. So again, the importance of looking at from a gender perspective on HIV prevention, even when you're focusing on adolescent girls and young women, is critically important. And just a nod to our portfolio around PrEP, which really is around expanding the HIV prevention package for adolescent girls and young women. We published a paper in 2016 in Lancet HIV that really lays out a framework. It's sort of a modified socio-ecological framework, but it brings together both the service and the community side for adolescent girls and young women. So in order for effective introduction of PrEP for adolescent girls, what do we need to do for effective provision and effective uptake and adherence, and the pieces that we need to pay attention to. We actually put this framework to use in our study in Tanzania, and one of the things, and we spoke to multiple stakeholders, and we find high congruence amongst the respondents that adolescent girls really do need PrEP due to the cultural circumstances they face and the risks they face. So Tanzania was one of those countries that was very hesitant about PrEP and had not introduced it till last year, till our study finished and our findings were shared. In a way, they wanted to understand what the acceptability of this medical intervention would be amongst the different stakeholders. So if you go to the next slide, not only did we find high congruence amongst all of these stakeholders that PrEP is needed for adolescent girls, but each of them talked about what are the challenges and facilitators for them. So our in-country representatives were very keen that we speak to parents, and parents, while they understood girls' risk, were also concerned about being seen as condoning sexual activity. At the same time, they themselves wanted tools and strategies on how to talk to their daughters and support them for HIV prevention efforts. Similarly, with partners, they felt that PrEP would be good, but they worried about relationship control and mistrust and wanted to be included in the programs that provided PrEP for adolescent girls. I'll just leave it at that because we can talk about providers and adolescent girls themselves. But what we want to highlight here is the importance of talking to the different constituents to help identify what are the kinds of challenges and facilitators that they're seeing that could help enhance the way that we introduce this new biomedical package. And as I've already spoken about a few times, I think this has been, while we are doing active engagement of stakeholders in all of our studies, I think in Tanzania it has been particularly successful because of where the country was in terms of thinking about PrEP. And we engaged our stakeholders early and often, maybe too often. There was at times weekly emails and WhatsApp messages going back and forth, where we had a first study to really talk about what we're going to be doing and allowed input from in-country stakeholders into the study design. The study data was, there was very frequent communication with this group throughout and sharing of the data and engaging really the stakeholders in data interpretation workshop, not just data sharing, but data interpretation workshops. This has led to now sort of a sea change in Tanzania where PrEP is being rolled out, demonstration projects are being conducted. We have been invited to be part of the PrEP technical advisory group. So a really great example of how some of this research is being taken up at the country level and sort of short-term change that's happening. And finally, a nod to some of the work that we're doing around really understanding how the DREAMS package is working, all of these things working. And understanding the package really requires looking at sort of three levels of the package. Understanding the implementation structures or the models that are being employed in each country, which are diverse. Looking at the implementer perspectives to understand what kind of work they're doing at startup, how do they sustain, what are the resources and capacity building that is needed, and understanding but the beneficiary perspective. And here the beneficiaries include adolescent girls, men, their parents. So the package for how the package is seen at the community level, what are the motivations for participation? Next slide, please. Some very brief snippets from that. One of the things that we've seen across countries is that the more complex this will sound very easy to say, the more complex the implementation model, the more time and effort it requires in coordination. On the ground, what that means is that if you have one partner implementing all of that complicated dreams package, you then need to build the time to build capacity for the team to be able to provide the full package. If you have multiple partners providing multiple components of the package, then you need to build time for them to think about how to coordinate, how to collaborate, how to align timelines, funding, our outreach. Do you need to think about, are we all reaching the same girls? Are we reaching different groups within the community? And if there are multiple agencies working with different target groups and different components, then it's sort of that coordination work gets amplified. We've also been talking, and my colleague Miriam will talk about the Girl Roster tool, thinking about more refined approaches and tools to think about who is at risk in these community-based settings, and the critical importance of getting parent and male partners to buy in. That continued to be a struggle, especially early on in the DREAMS programming, in getting young women to come to services. And one of the things that's working really well, again, I think this is a model based on a lot of the work the council has done, is around building this capacity of community-based mentors to effectively connect girls to programming. And both from the mentor's perspective as well as for the girls, this has been a really fruitful relationship. Next slide, please. So just key takeaways from the implementation science portfolio. We are talking about the importance of identifying context-specific vulnerability profiles to inform more targeted outreach and programming. We're talking about targeting programs towards men to address their high-risk behaviors and vulnerabilities to reduce HIV risk for adolescent girls and young women. We really do need to engage adolescent girls and key actors to support HIV prevention and introduction of oral PrEP for adolescent girls, and a very robust research utilization process that can lead to sort of rapid program and policy changes. These are programs that are implementing at scale, so that becomes a really key part of it. And as I said, please stay tuned. We're going to have very soon, in a couple of months, research results talking about both the costs as well as the program effects from the DREAMS interventions. And with that, I will pass to my colleague Miriam Temin to talk about the capacity strengthening work.
Great. Thanks very much to Julie and Sanyukta and to Chewe and Anju and others for inviting us here. Good morning, good afternoon, as relevant. And I don't know if you know that I actually used to work at UNICEF, so I was traversing these halls many years ago for 4 years, so this feels like a nice homecoming. So my career path has brought me to the Population Council, where I have been working as a director of capacity strengthening efforts, as was mentioned, under 2 phases. One focusing on the initial 10 DREAMS countries, funded by Girl Effect, a conversation that started with the Nike Foundation, and then secondly with PEPFAR via USAID, as was mentioned. So I'm going to talk to you a little about what we as the council have learned about girl-centered programming and how we have brought that to bear on this massive enterprise that is the DREAMS partnership. Thanks. So the Population Council has studied programs for young people, programs for youth across a number of regions over many, many years. And we have found that often adolescent girls miss out, that even in programs that are geared directly to meeting their needs are taken over by older women or by men, and that it's the very girls who are supposed to be reached and benefiting who tend to miss out. So as you see in the slide, there are a lot of assumptions made about reaching girls, and we don't reach girls because we assume that we have. We have been working on adolescence as a distinct life phase. As I'm sure many of you know here, the adolescent life phase is quite different. They're not just large children, they're not just small women. Adolescents are going through a very rapid clip of transitions, life transitions. For girls, this typically includes school dropout, it often includes having a baby, at least a pregnancy, it often includes getting married, it often includes moving, migrating, starting work. So many of these transitions that really differentiate this life phase from other ones. So we have learned that this merits a dedicated and unique response. Now, an important point has already been made by my colleagues, which are, of course, that not all adolescents are the same. It's not a one-size-fits-all response, but responding to their heterogeneity is particularly important, especially if you want to be reaching those girls who are known as hard to reach. So features like being in or out of school, for example, having a baby or not having a baby, being married, for example, very few programs that are reaching married girls. Why? Because they're not designed to reach married girls who may often be socially isolated. So Julie started to talk about the social asset building under dreams, and that is one of the features of vulnerability that we find coincides with many negative outcomes as girls go through these many transitions. Next slide, please. So it's a little hard to read, but this is the next level of detail of the slide that Julie showed you before, which is really a map from PEPFAR. This is their slide around the Dreams core package, and I'm not going to talk through all of the many activities, but you can see that there are many, many boxes, and I draw your attention to the one marked with a yellow arrow, which is social asset building. So one of several activity streams that seeks to empower girls and young women and reduce their risk is the social asset building. So through this channel, Dreams has provided the implementers with a tremendous platform to expand the coverage of evidence-informed activities for them. So why social assets? Next slide, please. It turns out they're important. Social isolation can be harmful for girls. On the flip side of that, of course, having social assets, social support, friendships, relationship, places to go in an emergency, relationships with older adult women can be very beneficial. So this, I just have only two simple data slides. So this is data from South Africa that was collected by my colleague Kelly Holman. And the green bars are males, the blue bars are females. And what it shows you amongst young women, 16 to 24, that having more friends makes a bigger difference for females than it does for males in terms of HIV testing. If you're a female, the more friends you have, the more likely it is that you're getting an HIV test. Next slide, please. Very similar story with condom use. Again, this is Kelly Holman's data, and these are odds ratios. So the green bar shows you that it's helpful to live in a community where you trust your neighbors. That's a form of social capital. It's called cognitive social capital. But the important point to note here is that girls who belong to a sports group, and these are young girls, 14 to 18-year-olds, are much, much more likely to use a condom than those who are not in a sports group. And that is a type of social capital called structural social capital, for those who are experts on that. So clearly, social assets are important. And it was data like that that convinced Ambassador Birx and others to include the social asset building as part of the constellation of Dreams approaches. Next slide, please. Now, of course, we at the Council have been working for many years to explore different ways to build girls' social assets, but also other types of protective assets. So we use what we call a protective asset framework, which is really sort of an organizing principle. It's a broad umbrella that allows us to talk about the different kinds of human stock that a girl needs in order to reduce her risks, increase her opportunities, and thrive in her transition to adulthood. So we are testing different ways and learning and adjusting how to build different types of assets that lead to outcomes like reduced child marriage, for example, like seeking health services, like reduction in violence, or indeed like reduced unsafe sexual behavior, and potentially someday HIV incidence, though we certainly have not managed to figure that out quite yet as the direct relationship. So we talk about, we categorize different types of assets. We've talked quite a bit about social assets. Mentorship has been mentioned, friendships, somewhere to go in an emergency, so you're not stuck with the male neighbor to borrow money from, which comes with risks. Cognitive assets, for example, literacy or communication skills. Human or health assets that can include access to health services, that could include PrEP, access, and certainly sexual health knowledge. And economic assets, knowledge about budgeting, savings, income generating skills like vocational training. And we continue to refine and test different ways to build assets and then do impact evaluations to try to understand what kind of effects we can bring about. So thanks very much. Now coming to what we have been doing specifically within the context of Dreams. We use different strategies to help bring core concepts and evidence and tools to bear. And we do this through workshops, both national workshops where we have had from, let's say, 2 organizations to 12 or 15 organizations participating. We've had regional workshops. We conduct webinars, and many of those are available on our website, I should say. We also have done a lot of remote coaching and technical assistance with our mentor organizations as they work in this totally new area. And then we provide and support the use of practical tools and resources, and I'm going to come back to that. Next slide, please. So this just shows, similar to Sanyukta's slide, where we have been working, and to point out that, of course, most of the DREAMS countries are in East and Southern Africa. We have done some capacity strengthening work in most of them, those that are in green. And then you will note that over there in West Africa, we have Cote d'Ivoire, which was added as one of the so-called DREAMS-like countries that recently received PEPFAR funding, and then that's a disproportionately sized Haiti floating there with thanks to my colleagues who put the map together. And so Haiti has also interestingly been included in the DREAMS-like, and they're really getting this programming off the ground. So, of course, we had the opportunity to participate in DREAMS because of this emphasis on the social asset building and other protective assets, but also because we have really been working very hard to reach girls and young women who have been left behind. And we've already heard a lot about how these pools of disproportionate risk have been sustained over the course of the HIV epidemic because a lot of HIV prevention programming has not reached girls. For example, we know that life skills-based education in schools is probably the most widespread HIV prevention intervention around the planet Earth, and that's not going to reach girls who are out of school. And as we heard from various colleagues, we know they often have the highest risk. So, next slide, please. We have been working to strengthen the capacity of implementing partners to build social and other protective assets by following a sequence of learning steps. So we pulled together our protective asset building strategy house, as we call it. And so as you can see here, this just is a nice handy communication tool to summarize what are those sequence of key learning steps that can help program staff collect and utilize information that is local, that is in real time, and that is centered on girls and young women, as well as evidence. So start with the girls to see the girls, including those who are less likely to be reached by traditional means, who might be off the grid, out of school. Segment to find the right girls. We've already heard quite a bit about this, and the type of work that Sanyukta described with the segmentation analyses is really going to help us to refine and do this better. Concentrate on the walkable community. So we emphasize with implementers that intentionally identifying your catchment area is important. It seems incredibly obvious, but it's often not done. But knowing the community, knowing the bounds of the community really helps to increase access. Many girls' mobility is greatly restricted when they pass through puberty, and we have evidence to support this. So placing your DREAMS hub, as they're called in some countries, in a place that is accessible to girls within her walkable community is more likely to enhance your participation. Establish community-based platforms. So groups often are using existing sites. It's not a matter of going out and building new platforms, but using schoolrooms in off hours on Saturdays, for example, using some kind of community center. Sometimes religious institutions offer space. I know sometimes groups have met under trees, but the point here is that it's an accessible platform that is conceived of as safe and as private. And then build social and other protective assets, as we have discussed earlier. And our approach suggests that when these learning steps are done in the right way, that you will be able to overcome the exclusion that has really challenged a lot of HIV prevention efforts to date. So now I'd like to turn to the practical tools and resources, and I know Chaiwei has a particular interest in these. So thanks to, thank you. Go back. So thanks to DREAMS, we were able to collect and pull together a lot of these practical program tools in our collection. I've got one copy here that you can take a look at, and it's been translated into French for some of the DREAMS countries as well as Spanish, and it contains many tools that support implementers moving through these learning steps. And this is all available on our website on the address there. I'm briefly going to touch on 4 of the tools in here and happy to follow up with any of you, but I'm going to be pretty quick given time now. Next slide, please. Thank you. So the Girl Roster tool is a tool that uses digital information collection on a phone or a tablet. It is a brief questionnaire that can be utilized with a minimum of training, and it poses non-sensitive questions at the household level to an adult. These are not questions that are posed specifically to girls themselves, and it asked about schooling status, living arrangements, age, marital status, as you can see. So there's nothing in there about experience of violence, there's nothing in there about sexual behavior, number of boyfriends, or anything like that. That's an important piece of what makes this tool useful. So it's user-friendly, and then it generates what we call an output table. You can see a sample there that just gives an indication. It's intended to be not a research tool, but a program design tool. It's intended to give an indication of the types of girls and young women that live in a program community. Having this information can provide a basis for targeted evidence-based program design decisions. For example, what are the type of girls and young women we need to be recruiting? What are going to be our eligibility characteristics? We can map these results, as you'll see in a moment. Where do these girls cluster? What is the right way to go about recruiting them? For example, if the majority of those you're trying to target are in or out of school. It can also be useful, this information, when you're monitoring your coverage and checking, do we have the right types of girls in our program? Again, it's a relatively blunt instrument. It's supposed to give what my colleague Judith Bruce calls a soil sample, not a specific, detailed scientific listing of who's there, but generally to give an indication of the types of girls and young women in a community. And here, as you can see in this sample, the girls who are reflected in that green box there, this is from the Women's Refugee Commission, by the way, those are girls that would be considered off track, meaning they do not possess the rights and entitlements that girls are supposed to have by a given age. They're not supposed to be married. They're not supposed to be out of school. They're not supposed to be married. Next slide, please. Alongside the Girl Roster tool, another digital information collection tool that's proven popular is called the Community Resource Scan. And this, again, is South Africa. We have a heavy South Africa bias in our slides here, with apologies. So this Community Resource Scan allows you to drop GPS coordinates and drop pins where there are girls, where there are households, and where there are key resources in the community that are either beneficial and provide opportunities or that might be risky. You can't really see on this slide, but one of these pins in this community in Sunnyside, South Africa, I believe, is many young dudes hanging around. Yes, that was how they described this, as from an actual community. So this can be a very useful addition. We have other ways to do this kind of community mapping. Next slide, please. So we also have pen and paper versions. Of course, the Community Resource Scan relies on having technology, but there are much cheaper ways to do this. And this, it's a very straightforward, very popular. I'm sure many of you are familiar with this idea about just going out and drawing these key features of a community, bounding your community, and then identifying what is where. And we work with implementers in our trainings to do this, and certainly this exercise can be very useful for various levels of program staff and for girls themselves. And I am not exaggerating when I tell you that this has been described as life-changing more than once at people in our trainings who have gone to the same communities. In Botswana, a woman who went to get her car washed in a particular community, and she'd been going there for many, many years, and she said it changed her life when she saw how the community could be seen through a girl's eyes, that it just really rocked her world in a very powerful way. Finally, I'd like to mention the Building Assets Toolkit. I brought a sample here if anybody wants to see it, and this has been translated also into Arabic and Zulu and Creole, I believe. And this is a kit that provides the various tools that enable a group, whether it's program staff or parents or community stakeholders, to talk about and agree on by what age a girl needs a certain asset in order to reduce her risk. So it contains many, many of these so-called asset cards. Apologies to folks on the phone. I'm holding them up, but they're these sort of hard cards. And then we have the age cards, and they're put up on the wall. And small groups discuss by what age does a girl need to know how to identify a safe water source, for example. By what age does she need to know that she has the same rights as her brother? I just picked these randomly out of the box, but this could be very much tailored to an HIV prevention program and context. And again, this is a tool that is very, very simple and almost obvious, but it enables people who haven't thought about the structural determinants of HIV risk to think about them, for example. So we've had many, many times where they going through this exercise and discussing it and disagreeing and arguing and coming to an agreement has really forced public health people or medical people to recognize, for example, the economic drivers of unsafe sexual behavior. So in closing, just to summarize what we have been working on in DREAMS and more broadly, and what we have available are practical resources that support programming for adolescent girls and young women that is informed by evidence. And we have certainly noticed both within the context of DREAMS as well as more broadly that there is a tremendous demand out there for technical assistance, for tools, for capacity strengthening, way more than we can fulfill. So we're very happy to be having this conversation with UNICEF because I know that's an area that you are working in. And so we have used these tools to help improve coverage and ensure particularly that the exclusion is not a feature of a girl programming going forward, and to help groups to refine and improve their content with relevant evidence-based material that is responsive to their particularities within their girl segment. And then we haven't really had time to talk about monitoring, but we also have tools that help support programmatic monitoring that help implementers learn and adjust and hopefully in due course evaluate, including within the context of the work my colleagues are doing. And this entails monitoring change both at the level of the girl or young woman and at the level of her community. So I will leave it at that, because I know we want to have time for questions, and thank you. And just to recognize, this is, funders, and this applies to both the implementation science portfolio as well as the capacity strengthening portfolio. I think we've mentioned all of these.
I did mention
with many thanks to them. Thanks to all of you for your attention.
There's one more slide that we can just leave it on.
Yeah.
No, great. Anju has stepped out for a few minutes. But just to say that this is a joint session with the HIV program as well as gender here at UNICEF. So she'll take over from me if she walks through the door for this session. But yeah, we've come to the question and answer session. We have some questions that are coming through from the people online. And maybe I can start with one of the questions from our colleague in Cote d'Ivoire, Dr. Condom. And he's asking, this is all very good and very nice, but how are we engaging national partners in this work? And I guess you touched on some of it when you're making your presentation around how you co-create the studies with government, but they want to know how we engage in governments. And then the other thing that they're asking, Dr. Conan is asking, is that you said that this partnership is not a fund, but how are we engaging Global Fund, for example, in this work and learning from what you're doing? So maybe I'll leave it at that, and then if people have questions, we'll come up with a...
So would you like to do a list of questions? Us to answer questions and then we go back.
I think answer these two while people are preparing.
Okay. Sounds
Okay.
We should move that
happy.
the turtle.
Okay.
Sure. So you do want to take that one?
Yeah, sure. So I think the first question was around how are we engaging national partners. Certainly for the implementation science research portfolio, engaging national partners is a key component of how we are doing the research. And as I mentioned, I mean, if you want to think about it in a simplified way, we're engaging national partners, and this includes representatives from ministries of health, but also other ministries. At the initiation stages of the study, once we've collected the initial round of data, doing data interpretation workshops, and then thinking about really how these results are going to be used in country. And then sort of laying out a process to identify champions in country who can take the work forward. So, for instance, at our meeting in Kenya, and my colleague Dr. O'Call can speak to this, we had folks from the Ministry of Education at our initial data sharing workshop. And I think it was really fascinating to them to hear what low HIV knowledge and condom use, the health information that was very low amongst adolescent girls, and that fostered discussion amongst the Kenyan colleagues at the table about how they can support each other for some of the work. So I think that's one of the ways that we have been engaging national partners. And I think Miriam, I can pass to you if you want to answer that question as well. But I just want to say that the way that we're engaging Global Fund is that we have been actually trying to share our emerging results early and often with the Global Fund too. So looking at opportunities to and hearing about what their approach and programming is, and thinking about how some of the work that we're finding about implementation models, how the challenges partners have faced, how they've overcome them, that those are fed in now as Global Fund programs are getting rolled out.
And I just want to say that within the global landscape, UNICEF and PEPFAR are actually co-leading the work on adolescent girls and young women. And within that, the Global Fund is also a partner. And we've had various meetings to discuss their own investments. And UNICEF and WHO are also supporting in terms of TA to the Global Fund. But at a recent meeting we had with all the partners that are engaged in this work, it was also about looking at the packages that are being proposed by Greens and the ones that are highlighted in the guidance that was put together by the UN, led by UNAIDS, on what we need to do for this population. And I think there is coherence in thinking at the global level, and so there's already engagement on how effectively we can move on this particular agenda. Dorothy, you had questions?
I had go ahead.
I just want to say very briefly that in a number of countries we've been fortunate that representatives of the government ministries have participated in our workshops and have been trained alongside. So in South Africa, for example, with apologies, I'd have to check my notes on which ministry it was, but social welfare possibly. They were so taken with the overall approach that they are replicating it themselves and including groups with boys. But to be sure, the degree of engagement with government stakeholders, I think we've been working mainly with the U.S. government interlocutors, the USAID, PEPFAR, and CDC reps. But certainly we've found it to be very fruitful collaboration in some countries.
Thanks, Miriam. Dorothy?
Okay, so
we'll take a few questions.
Okay, thank you very much for your presentations. Very informative, very interesting work. I have maybe 3 questions. One, I wanted to understand more about your girl roster. From whose perspective? I mean, so you have some criteria. Do you get input from the girls themselves as to things that make them vulnerable? Maybe you said it and maybe I didn't get it. So just to try and understand that a little bit better. And then the other thing is, I'm really excited that you're involving the male partners or trying to work with male partners. And I wonder the way you're structuring this. Is it men, you're the problem? Or these are the good thing, this is what good men do. So is it a positive model, or is it sort of like, you guys are such a problem, we need to sort you out? So I'd like to hear how you structure that conversation with the young men. And then the last thing I wanted to talk about is the notion of community. I struggle with this, because you talked a lot about Kenya. So if you're in Nairobi and there's the urban Kibera slum, how do you define community? And then how then do you map out these things for the girls, the social assets, blah, 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 for girls? When you're more rural, it's easier. So I'd like to hear how you're doing this in the more urban informal settlement type places. Thank you.
So we'll take a few more questions. Christina.
Okay, thank you very much.
Say who you are and what you work on.
Yes, my name is Christina de Carvalho Eriksson. I work in the health section here at UNICEF as an adolescent health specialist. So thank you very much for this very interesting presentation. And I wanted to understand, I know the focus is communities, and the the questions in that box, I think are probably very coherent with comprehensive sexuality education package. And I wanted to understand how these complement each other. I know the CEC is school-based, but just to understand how these two relate. And then also really great with the targeting of men and male partners. I also wanted to know about tackling gender norms earlier and working with adolescent boys and young boys from the beginning, before they may become these male partners that may do damage, and how actually to make them good or support them to be good partners. So those two aspects would be. And finally, are you also working with local academia in also not only ministries but academia in? Yeah. Thank you.
We have 2 more questions, and I'm sorry I won't be able to take any more. We have a 11 o'clock stop, right?
No, we have a 12 o'clock stop.
Well, that's in 10 minutes. You're an hour off.
10 minutes. Stop, so we've got 10 minutes. So we'll take the rest of the question, but if you can keep them short.
Okay, hi, I'm Natalia Lino from the UN Development Program. My question is, since you're addressing structural determinants, are you also looking at the outcomes that are non-HIV related, for example, education, violence reductions, so we could see the co-benefits? And the second question is on the men and boys. Adding on to the question is, are you asking men to have less partners? Because I saw the partner risk as well as the consistent condom use, or is it more the consistent condom use? And given the data on the sexual violence by non-intimate partners, the 25%, where is this violence happening? Is it in schools? Is it, like, have you figured out a little bit who the the perpetrators are and how to engage them? Thanks.
Hi, I'm Jessica Rodriguez from the HIV section. Thank you very much for your presentation. There's a lot of studies and literature coming out showing the effect of food insecurity and hunger and HIV risk, with transactional sex being the pathway towards that. So does your program address food insecurity and nutrition for young women in terms of reducing their HIV risk and likelihood of engaging in transactional sex? I know it addresses economic strengthening, but in terms of food support. And then could you talk a little bit more about the findings around PrEP use? Because there have also been a lot of studies showing that young women might feel they might be perceived as being promiscuous if they're taking PrEP, and so if you could talk about that a little bit more.
Right, we have a question here.
Thank you so much. It's really great to learn about your work. I just wanted to ask about, so my name is Viniera and I'm working with Child and Community Health Unit here just for the period of the summer, but I wanted to really ask what would be the engagement of mothers, in this program. I think it's great that you're targeting male partners, and especially since you mentioned that orphan girls have a higher risk. I was wondering if you were also working with the relevant ministries of social welfare to really ensure family environment and develop those, contribute to developing those values of gender equality starting from the family. Thank you.
Okay, so there's more questions online, and maybe what we'll do is we will type them up, and maybe you can send us some feedback on some of them. But I think there's a question around from online about what is actually meant by empowerment. What are the components of that? There's also a question around what about the girls who are orphans, who are not in school? What are the approaches to reach them, and what's actually being done? So I'll pass it on to Julie, and you can see how
to disseminate and distribute.
Yeah, I think.
So what I was thinking, thank you, Chair. What I was thinking is that I kind of could take the male partner related questions, and I'm not sure how you want to split up the
I think it seems obvious to me.
It's clear to you guys how you want to break that.
Fair enough.
Okay, so shall I start with the male part.
Yeah,
Knock yourself up.
So be engaging, and of course, Anne, who's the other PI with me, if you have other contributions, you are very welcome. So I guess I would say that we come at this work with a gender transformational perspective. So we see that if you were going to try to address these outcomes, you have to deal with the entire community, and that gender isn't just equal to women, gender is equal to everyone in society, and that these gender norms and structural inequities are reproduced in a given location by both women and men. You learn them very early. You talked about how do you address some of those issues early on. So that's kind of our perspective, and as well as seeing the positive ways of going forward to do it. So our framing, which isn't necessarily the way that every single intervention partner through DREAMS frames it, because we don't implement the DREAMS activities ourselves. We are providing technical assistance on how we would do this to empower young women, and we are providing the research around it with some feedback about findings, but we are not implementing this program. So our perspective, and we've had these discussions before, just coming to your original question, are you framing men as the bad guys who are transmitting HIV to these young women, and therefore you've got to find them to stop them from doing this? Or how are you seeing this in a more holistic way, where men have their challenges as well, they have vulnerabilities, there are vulnerable men like MSM or male sex workers, etc., that take more of a gender transformational perspective. So we come at it more with, you need to address everybody's needs. And what Sanyukta was highlighting with some of the results are not only are you seeing men's risk behaviors that then lead to their transmission and risk for them, but they're also living in very difficult circumstances themselves, exposed to violence as children, as adults, etc. And so to address these then risky behaviors later on, you need to meet men's needs and how they're exposed and leading to their own trauma and risk. So that's kind of our take on it. And we have a whole other line of research around gender transformational programming. So I don't know if you've heard of the GEM scale, the Gender Equitable Men scale. I designed it with Gary Barker. So we did the early work with Promundo, if you know about sort of the gender transformational work and the men engaged kind of work. So we have a whole other line of research about working with men from very early on to try to shift these norms and critically reflect on what are the harms that current gender norms can bring to both men and women. It's not just women, homicide, alcoholism, heart attacks, etc. So that's, I think, tries to cover many of the kind of the answers. So that's the problem or positive, that's how you tackle it early on, and happy to talk more about kind of this gender transformational programming at any moment. Anything you would add to that, Anne?
No. So there were more questions. Are you going to? I think there's a question on the girls' roster.
Right. So do you want
from whose perspective?
That would be
Sure.
Miriam.
Yeah. There are three of these questions that so the girl roster tool asks a standard set of questions. It was those that you saw. So if it's modified, it becomes a different tool, and that's fine. But it's really to be used in concert with other tools that dig more deeply into more sensitive topics. And an important part of the execution is that questions are posed to an adult. It gets ethically very complex very quickly if you're soliciting information from young people, particularly given that this is a program tool where we don't seek IRB approval, and really it's the program staff who generate, use, and protect this information that they collect. But the whole approach of being girl-centered is highly participatory. The girls and young women in a program should be playing a major role in shaping every aspect of the program, really, in the monitoring and prioritizing content. We have many participatory activities that really brings girls' voices and perspectives into the proceedings. In terms of the question, I believe you asked, I'm sorry, from the health section, I didn't catch your name, about the
comprehensive
sexuality education, right? So within DREAMS,
young boys earlier.
Within DREAMS, the content that the implementing partners are utilizing has all to be approved through official U.S. government channels. So they have set curricula that have varying degrees of evidence behind them. Family Matters, Stepping Stone, SASA being a few of those that you may be familiar with. So it's not a matter of us going, if a group decides they want to address economic empowerment or they want to address food insecurity, for example, we can say, here are resources that have been used in other settings you might consider. You might talk to your USAID or CDC rep about these, but they have to use these approved curricula. However, you will certainly find that, for example, in the protective asset toolkit that you were looking at as you were speaking, there is a lot about power relations, about gender, and we do at the Population Council have quite a large body of work around those issues, and we have a training guide that has been developed based on a broad partnership. It's called It's All One. UNESCO has been very much involved with this as well, and potentially UNICEF, that is a curriculum and training guide for comprehensive sexuality education that does address power relations and gender norms, but that is not part of DREAMS. So I could go into the community piece, but I'm not sure the person who asked the question is, you asked the question about community. So just very briefly, community, point well taken, that it's not always easy to identify, but really understanding how a girl perceives of her community is the starting point for having that conversation. And if you want girls to come, you have to make sure they can reach your program on a regular basis. So providing transport vouchers, for example, in settings like, I know I've worked with a group in South Africa where the girls are actually coming from quite far away, and the only way they come is with transport vouchers. But it doesn't mean that it's a independently obvious community. It's 200 households within a particular catchment area. That makes sense. Or very, very often it's pegged to the catchment population for a school. So maybe if a group meets in school grounds and off hours, the obvious catchment population is that surrounding the school or a health clinic, for example. So I touched on some of them.
Linked to the hotspot analysis in terms of where these risks are concentrated.
Right, but the hotspots, they're subnational units, but they're still pretty large.
Yeah. Okay.
So going actually much more detailed is important.
To link to these structures when you okay, so I just wanted to, online there's and I think that's probably the last question we're going to have to address. There are questions around outcomes outside HIV incidents, right, and whether we're measuring that. And I think there was a similar question here, outcomes that are non-HIV related.
And I think that it's really an important contribution that we can make there. So please.
So the short answer to that, given the time, is that yes. In fact, we are measuring a range of outcomes that are associated with HIV-related risk. So the reason that we have data on sexual violence experience, not just with intimate partners, but also with non-intimate partners, is because we have thought about measuring that. Same with food insecurity, which is often not measured in HIV programming, and particularly not with adolescent girls. And similarly, trying to understand PrEP and the perspectives from different sort of audiences and stakeholders. So I think what we are, because the DREAMS model has that sort of comprehensive approach, the way that we've designed the implementation science studies is to look not just at the HIV-related outcomes, but all of the social structural knowledge and attitude outcomes that are, for girls, I think, sometimes very proximately connected to the HIV or the health and development outcomes. So yes, we are looking at those.
Measurement of empowerment, that was another question.
Okay, so do you want to do the measurement of empowerment?
Go ahead,
I just wanted to add to this other point about the advantage of looking at all of these different components. So the expectation is if you're going to address these gender dynamics, these power dynamics, you end up with all sorts of positive outcomes, whether it be related to violence or related to HIV or unwanted pregnancy, et cetera. And so one of my hopes and goals is that we want to show how these types of strategies can lead to all these positive outcomes, so that there is a more bang for the buck across all these multi-sectoral components, so that we can have more people in the room, thinking about investment, thinking about how you are able to get something out of it for education, for income, etc. So that is my hope, that we can do that kind of analysis to show that.
There's a question on food insecurity, but maybe I'll let that pass. You can give us the response later. But a lot of interest in how to access the toolkit.
Yes, so it is, I don't know if the slide deck is going to be available, but the website address is there. I can follow up. I know Lola has all of these in soft copy, I believe, because I've emailed it to you. I'm happy to leave, probably not the asset tools box, but the collection, if that would be useful and folks want to access it. But those who are on the phone, these are all on our website, and if you go to a tools and resources for girl-centered programming, sometimes our website is admittedly a little hard to access, but my name is Miriam Temin, T-E-M-I-N. If you look me up and then click on my project, you'll find it. I find sometimes people have a hard time navigating the Pop Council's website, but we are constantly improving it. So
French versions?
So
now we like to have the French version.
you can have it right now because it's on the website.
Okay. Great.
And Spanish.
Okay.
Jay, do you want me to end with a response to the empowerment question?
Yes.
Yes. We won't get.
I know we're past the time
Yeah,
now,
okay,
actually. I think I'll be brief in the sense that the way that we are measuring empowerment, again, the way that is being defined by the program implementers, but I can't speak to that. What I can speak to is how we're measuring empowerment. And again, trying to look at different components of adolescent girls' empowerment. So that includes both their gender norms and attitudes, looking at interpersonal power within relationships, looking at self-efficacy, both for accessing health services and accessing information about health, and then looking at experiences of violence and care and sort of connectedness to key adults in order to address or mitigate the experiences of that. So we have various components of the broader empowerment framework. We have also included questions in our surveys with girls, particularly around economic agency and access to economic resources. So these are young women who are facing a lot of these transitions, and in our surveys we've tried to be fairly comprehensive in looking at all of these different components. Anything to add, Shirley?
Just to say that we'll be able to look at these different facets and combine and contrast them. So we'll end up with more of a robust measure of empowerment that taps into a lot of these different topics we're talking about.
Thank you, Tayway.
Thank you very much.